Good morning. Welcome to Health Services. First order of business is to approve Wednesday's committee meeting minutes. Motion made by Supervisor Conover, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay, we have Lloyd and Betsy from Westmount. Lloyd, go right ahead.
Okay. Thank you, Mr. Chairman. Betsy's been nice enough to come down and grace us with her presence today, so she's got several items that she's prepared on the agenda. We're going to turn the meeting over to her.
Okay, first item on the agenda, miscellaneous resolution request 20. Appropriate fund balance for $795,790 to cover budget amendments. I think it kind of coordinates with the second item on the agenda, resolution request 7, to amend various 2015 revenues and expenditures to meet the needs of Westmount. And if you look at the attachment, basically what I did was amend and appropriate revenues and expenditures for 2 more months, for November and December. And the difference is what we are appropriating. On the very last page is the appropriated fund balance amount. I did a couple of different things. The revenues do not include IGT. That was appropriated in January through April revenues, so I did not touch that for the revenues for this time. It also includes a higher private pay rate of $325 a day for the next 2 months, and a higher Medicaid rate. During budget, I used $159 per day, and this is using $178.58 per day. The Medicaid rate was increased due to cogeneration, depreciation, and interest payments that we are now receiving. The expenditures did not include workers' comp. That was paid in January. The expenditures does not include the general liability insurance that has already been paid. A couple of yearly contracts have already been made, so I did no adjustments to the billing software, which is $5,800 for the year, which has already been paid. The auditor's fees have already been paid, which is $13,500. Leading age dues, which is $5,603. So I did not amend those expenditures.
Paul, I'm assuming you reviewed this. You're comfortable with all of this?
Yes.
Supervisor Conover?
Just so I'm clear, the request is to transfer $398,790 of unobligated fund balance,
Correct.
Unappropriated fund balance, to the operating budget, the
Correct.
annual operating budget. Does this deplete the fund balance?
Yes. No, there are additional fund balance. There's an additional fund balance. Leaving a balance of $271,000. We started off with 1.4, appropriated 811 approximately, and now we're asking for 398,790. So it does leave 271,10.
I'm just wondering from a cash position going forward, what...
We have very poor cash flow. We owe the county 1.8. We've budgeted 1.4 from IGT, which we're still in the process of receiving for this year.
This should all work out, though, based on what occurred, as I'm sure everybody knows now, because it was in the paper today. Yesterday, we did receive the committee approval for the sale of Westmount, transfer of the CON. There's still some procedural steps that need to be gotten through. That has to also go to the council yet, but we have every reason to believe that we should be in a pretty good position to close, if not at the end of this year, and that's what the target is for everybody. But there's some work to be done, and everybody's going to have to hustle. But if we can close it by the end of the year, from what we see and what we've projected, we see absolutely no problems going forward. If it drifts into January, obviously it costs a little bit more, but here again, we're still in nice shape. When we show you the multi-year planning document. We have accounted for all of this, and you'll see as a result of the sale, a nice positive cash flow next year as opposed to a negative one that you would have if you were still owning the facility.
Very good. Thank you.
Just a quick question, Betsy, on page 15 of 17, legal services for $7,000.
Do I want in it?
There's a $7,000 budget amendment, page 15 of 17.
That probably should not be there. That's probably in the wrong column. You know, should be there. That is what we pay to, Bartlett Pontiff,
Okay, and what specifically is that for?
for the Siemens, contract and for the sale.
Okay. So it, does that item, what you just said, does that come out of two budgets or just the Westmount budget? The services for the Bartlett firm for Siemens and for Cogen or?
I don't know. I do know we get a bill,
Okay.
a monthly bill, and we also get an occasional bill for the Siemens contract whenever they work on it. I don't know who else gets one.
I guess my question is is that seven,
On top of?
do monies for the Bartlett firm come out of another budget also, in addition to the Westmount budget?
Well, they're doing different things for us, so it's possible, I guess I have to go back and take a look at it, because you remember, they're handling the labor issues with the facility, they're handling the closing on the facility, plus they're handling the Siemens litigation, so I'd have to go back and take a look at how those are being funded, but, you know, to give you an answer, but they are doing different things for the county at different levels there.
So, we're not quite sure at this point, but we'll get clarification on.
Certainly, we can, absolutely. You know, we can certainly,
Right, if you, I'd
do that.
email it out.
Yeah.
Good, thank you.
Okay, I'm assuming we're gonna need a motion on this. Made by Supervisor Conover, second by Supervisor McDevitt. Any other questions? All in favor?
Aye.
Opposed? Carried. Okay.
That's the two that I have.
Okay. You didn't mention universal settlement, if you just wanna say what you expect from that.
The IGT is taking a back seat to the universal settlement. We are, I guess, supposed to receive $339,000 over a 5-year period of about $69,000 a year. And that will probably be settled before the IGT payment is received, according to Mike McCarthy. We have 5 appeals that are excluded from the universal settlement, which is very good, which means that we will get paid for our Cogen appeals.
It's just a matter of when.
Right.
That's great. Okay.
All right, just a couple other items on the agenda. Mike could not be here today. He was with us all day yesterday, so I think we utilized him quite a bit yesterday, so he had another engagement he just couldn't pull away from today, so that's why he's not here today. On the staffing front over at Westmount, we've hired 2 new basic unit managers, which was our problem positions we've been talking about for the last few months, and I think the action of this committee to secure an increased wage for those positions helped out with us being able to recruit for that. So we're okay there now. We still have, you know, several openings within the staff, but, you know, I think we're on the rebound. They're doing quite well. We've had a lot of our disability people have started to return to work, mostly the CNAs who were on maternity leave. So we anticipated they would be back, and they have returned, so we're very happy about that also. So staffing is pretty, you know, it's always a challenge, obviously, but we're doing fine at this point in time. As far as, what was the other topic we wanted to talk about? Oh, census. Census has been a challenge all summer, I think, for almost every home in the area. But we recently gotten up to back over 70. We're up 72 today, and 8 empties. And we talked to Mary before we came over, does the admissions. We have 2 scheduled for next week, so we're getting the census back where we need, which will obviously help with the cash flow a little bit. So most of the people that are coming in a lot of them are short term, which means we're billing Medicare, which means, you know, a higher rate basically. So that's basically our report today. We've done what we had to do. We've had a few meetings here in a row, but if there's any questions for us, I'd be happy to answer them.
Anything from the other supervisors?
Yeah.
Supervisor Brock?
Now that, excuse me, now that Centers is gonna take over, how does that happen? Is it like one day they just walk in? Or are they gonna come in early, or how do we figure out the budget? I mean, is there like a drop, you know, a deadline date that one is theirs and one is ours? How's that whole thing gonna work, or do we have that figured out yet, or?
Well, ultimately, there will be a one day where the shift is made, and that has yet to be determined because of the number of steps that have to be involved. But there will be meetings. In fact, we spoke with Mr. Greenberg yesterday, and he will be coming up to meet with the staff at the facility. Lloyd spoke with him yesterday. It turned out that we had actually met him when we were down in New York. Lloyd and I just didn't connect the face and the name till we saw him. And very nice gentleman, very professional, very knowledgeable. And they'll be coming back up, and he'll bring some of the staff from Centers with him and stuff. And so I think we'll have a good, and then we asked him if he wouldn't mind, you know, meeting with the committee when he comes up as well. So that'll be all part of, you know, there will be a transition process. Lloyd will be key in all of that. Fortunately for us, Lloyd, you may want to tell him, you've had experience in this type of thing.
Yeah, when I was with Mr. Eden Park for over 30 years, they were purchased by National Healthcare Associates. And it's a very similar type of transition. A little different for the county in the sense that, you know, Eden Park was an entity, and we didn't have to change phones, we didn't have to change payroll vendors, we didn't have to change all these items. They came in, we had to do inventories, you know, I had to know what they were buying, we had to do a lot of things of that nature. But basically it was an intact object that they purchased. Here, you know, we're tied in the county in so many ways that we have to be factored out of. And those are the issues that are gonna probably take a little time, because they've gotta have a new phone system ready to go day one. They've gotta have whatever we do with computers day one, and payroll system day one. So there's a lot of things of that nature that are gonna have to take precedence. We don't have electronic medical records over there. We don't have a lot of things of that nature that they're gonna have to modify or change. But I mentioned they'll be purchasing them. But there's a lot of those types of things we'll be working on. So this change will be smooth and hopefully very seamless.
Well, that was sort of what I was getting to. How does the cost, do they bear the cost, or do we bear some of the cost, or how, you know, like with the change of the phone system?
That'll be theirs. That'll be theirs.
Don't we
Whatever they
have to,
select, you know.
don't we have to disconnect, or?
Well, yeah, we'll have certain things we have to do on our end, certainly.
I mean, I don't
We
know
have some
what
of the IT boys over there doing their thing.
The what?
The IT guys from the county will be over, and like they are now, and they'll remove whatever they have to and take care of that.
Supervisor Seibert?
Just a Pete's question, and I think it's a good one about the amount of money being paid out to special counsel. It was my understanding from talking with the treasurer a few weeks ago, he had told me it was about $4,500 a month as it related just to the Westmount sale, not to include the Siemens litigation. So I guess what I'm wondering, obviously that's a lot more than $7,000 a year in one budget. But to understand the budget in its entirety as we're going forward, when we get that clarification from the county administrator, is there a way just to break down, you know, what budgets it is coming out of and the total amount that we're expending towards special counsel? Because I'm assuming there must be some in the county attorney's budget as well. But it sounds like it's a little bit in all different budgets, and I would like to know how much we're actually paying out. I had a discussion with Martin the other day. If we're spending all this money out to special counsel, perhaps it's a little more financially doable to be looking at a county attorney's position instead of paying so much out to a special counsel. although he did say that we have a few things pending right now that are increasing that cost that he sees going away in the future. But from just those numbers, $4,500 a month just for Westmount obviously really exceeds just $7,000 that we're looking at in your budget for Westmount. So just the numbers seem a little off.
Supervisor McDevitt?
Just one quick observation, that, you know, we all get involved with issues in this world, and, you know, we feel deeply about them. We argue as factually and as intelligently as we can, but the issue, as far as I'm concerned, is over. I mean, that was settled yesterday. So I would ask, as Paul suggested, that we get to the closing table as quickly as possible. Let's make the transition. We fight the good fight. Sometimes you win, sometimes you lose, and it is what it is. So that being said, charge on to the closing table.
Thank you. Anyone else? Anything else? Okay. We have public health next, so sit tight, please. Thank you, guys.
Will we at any point be meeting with Mr. or are we just supposed to look this over on our own, and if we have questions?
Tonight you read that, okay?
If you have trouble sleeping.
That's right.
Becky, do you know if he's coming back?
You go to sleep after.
Well, we can certainly have him, and traditionally he has come, so
Yeah.
why don't we make sure we have him
I
for
don't sleep with sewer problems,
Yeah.
and I'm not gonna now worry about that.
Supervisor Frazier, he will be here, we'll make sure he comes and reviews this.
Okay, I just know that we normally do that, even though he wasn't here, I just wondered if at a later date he was coming.
Yeah, we'll ask him to be in attendance for your next month's meeting.
Thank you.
Have a good day, guys.
Thank
Thank you.
Enjoy the weather.
Betsy, do you want to coordinate that with him?
Now see the light
Well,
at the end of the
I don't want
tunnel
to forget
toward
to do it, so if you can
retirement.
set it up for the next month's meeting.
How's it going, Betsy, by the way?
What?
How's it going? Like it?
Thank you.
Good seeing you.
Comes the paperwork.
Yeah.
Trying to double size. Oh, my word.
We have a mutual friend.
Oh, she is?
Yeah.
We're doing it for optimists.
Morning
It's
again.
right on the national convention.
Thank you.
Oh, I'm glad we're moving things right up a little.
Back on the road, back to Tongue Mountain.
Oh, listen, I'm working on my own budget, so.
Room reservation.
A little smaller than this one, huh?
Just as many issues.
Oh, I'm
We're
sure,
trying to figure out.
I'm sure.
Bye.
No, I'm sure.
Thank you for grabbing that, I really didn't know.
Oh, you got the straight chair.
My feet, I mean, I got like
I
this.
can see that.
It's awesome.
Those are the 1950s chairs.
No, that's,
Now I feel nice and
They're
tall.
hard as rock.
No, oh, not even close.
Yeah.
Oh, yeah, last time was a mess.
oh, really? Oh.
Mm.
You gals ready? Makes it easier, doesn't it? All right. Okay, good morning, ladies. Pat, I will turn it over to you. Go right ahead.
Okay, I think on the agenda, probably 1 and 2 are already done, since this is a continuing meeting. So we can move right on to our action agenda, which is brief, and then we get on to our budget information. First thing, we'd like to request a resolution to authorize a contract with Catherine Kitchen to provide OT services, and they're billable. And we need this type of service for adult clients right now.
Motion made by Supervisor McDevitt, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, and then we'd like to request, a resolution for budget transfers, and you'll see, on attachment 5 for the specific detail. Tom, if you wanna add anything?
These are adjustments, transfers between departments. Primarily, most of them are to cover, in the CHAZ case, we had 4 people retire this year, so expenses moved from health insurance to retiree health. so I'm moving some money to cover that. Also retirement expenses, seem to be under budget right now, so I was trying to cover those. Moving again money from long-term care where we have some excess over into retirement expense. And the first one is we have to pay to the, state cash assessment, and it's, becoming less for long-term care as that program goes away and more for health services, so I'm moving money from long-term care there and to health services for primarily the cash assessment. But most of them are to recover, some of the employee benefits that are right now showing a little bit below budget, so we need to move some money.
Motion made by Supervisor Frazier, second by Supervisor Conover. Any discussion? All in favor?
Aye.
Opposed? Carried.
Okay, moving on, we'd like to request a resolution for some budget amendments. We've gotten some COLA awards. We don't have to amend the contracts because it's written in that we can accept the money, but we never know how much COLA amounts are gonna be. So when we find that out, then we need to do budget amendments. And you'll see the amounts there are reflected. Luckily, they're all here pretty much at the same time. And there.
We have 4 COLAs. We just recently received our WIC program, for our rabies program, our immunization action program, and our children's special needs program. All of them have given us some amounts for COLA, and we'd like to amend the budgets to accept those.
Okay, motion made by Supervisor Conover, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, we have no pending items for this month. And moving on to information for discussion and review, you'll see our monthly emergency response preparedness activities report on attachment number 1. Nothing, particularly, new and different there. Moving on to status of referrals, we're holding our own there. Sharon, do you have any comments?
No, we're actually up 1% than we were last year at this time. The referrals are still strong.
Moving on to expenditures and revenues, you'll see the report there. For expenditures and revenues and.
Attachment 2. Primarily, we're, in the middle of right now, or not in the middle, I should say, at the end of closing our August for our, CHA, long-term, and MCH. So those numbers are not reflected here, but we're pretty much where we should be in relation to the impact to the county compared to budget and compared to last year. If you look at our salaries at the bottom of the page, again, you'll see we're slightly up in regular salaries and definitely in the part-time salaries, and that's due to the positions that are still open, full-time positions in the nursing. We've been able to utilize some per diem nurses to cover that. And our overtime overall is down by $1,260. So that's good too. Again, by utilizing the part-time as much as we can, we've helped keep that down. On attachment number 3, which is our comparison last year to this year, again, you'll see that it's not that far off. We're pretty much still on target to where we should be. Revenues are slightly down, but again, that's because we haven't closed August, and as soon as we get that done, that'll bring that up to where we need to be.
Okay, any comments, or go ahead,
I just have a quick question. Going to attachment 4, just because I don't understand what this means, I look at the middle of the page there, it's 2014. You see minus 9%, and then you see some more minuses, then you come down to 15. What do those minuses mean? What's the significance of that? Is there something happening? Is there something happening out there that?
We have a competition now that we didn't have.
Okay.
Prior to 2013, we were the only certified agency serving Warren County Health Services, which means we can bill Medicare and Medicaid directly for home care services.
Okay.
In 2013, with the new state regulations, they opened up the certificate of need, and now we have 5 other certified agencies serving the same population.
Okay.
So what we did was track the referrals to see where we stand. How much business are we going to lose?
Okay.
Overall, our first year with the competitors, we lost, I believe, I have down here, like 7% overall. Now, last year, in comparing us in 2015 to 2014, we're coming up.
Okay.
We're regaining some of that loss. So
Yeah,
that's
well,
good.
you guys.
So we've held our own. We're still
Yeah,
the
yeah.
preferred CHA within serving the residents of Warren County.
Well, you
And our
guys-
referral sources, largest is, Glens Falls, Q Care Hospital, Glens Falls, Albany Meadows Hospitals, and also the physician groups.
Good,
in
well,
our
well,
county.
well, thank you, you guys appear to be definitely on top of it, and it's,
Well, thank you.
appreciate it, yeah.
Yep.
Chairman?
One of the things we noticed yesterday on the, agenda form for DOH in New York City was there's at least 2 other organizations wanting to get into the counties up north, and not just Warren, but I saw in there, and he left before they did the promo of those healthcare agencies, but there's like 2 more wanting to get into this whole area, Warren, Washington, Fulton, Northern, and, I thought that was, that's pretty telling, you know.
Right.
They're still trying to get approval
Right.
to come up in our
A
area.
lot of the opening up of the CON within the state, within our district or within the state, really had to do with the Medicaid, reform and wanting to have more choices for these, managed long-term care companies to take over these, this particular population. So you're gonna see that big move, throughout all of New York State.
Yeah, just as an aside too, I'd like to state, you know, I had a constituent in Queensbury call me, who I work with, and he had nothing but praise, and I called Pat and told her, for the nurses, the visiting nurses who came in and cared for, his ailment, nothing but praise for him, you know, and that's the consensus, anytime you're dealing with our Department of Health, they have nothing but praise for what our nurses do, so we appreciate that. I mean, I know I appreciate it, and I always try to tell Pat immediately.
And I pass it on.
Well, thank you very much, and we pass that on to the staff. We're required to have what's called CAP surveys, and they're required by our CMS or Medicare, and we're in the 90 percentile for satisfaction on our returns, and that's handled by an independent contractor. So we do very well, but thank you.
One of the things that's concerning about the new agencies coming in, and we're seeing it, the nursing pool is only as much as the nursing pool is, and we've tried to get contracts with a couple of the agencies, and they pulled out because they said they can't come here because they can't get people.
If I think of it, I have my copy of the agenda, I'll give you a call, Pat, and tell you who they were.
Okay.
I don't know if you brought one home, Paul. Did you bring the agenda home?
No, I can't remember now, I have to take a look at my papers.
But if not, I'll look it up and tell you who they were.
I've got it here if you'd like it, the agenda, yeah.
Yeah, there's 2 of them.
Yeah, just let me echo what our chairman said, and, you know, I've had personal experience with my wife as well as myself with my hip replacement. I've used the county visiting nurses, and I can speak from firsthand experience. You guys are just stupendous, okay? You do a remarkable job, and, so I think at the end of the day, I think we'll find over time is that your so-called competition, in reality, won't be competition, okay? You'll just drive them out of the business, so.
So moving on, can we just skip our budget presentation?
That was good.
No, anyway, we are really proud of our staff and the work that we do, and, budget, nobody likes the budget process. And I will say that we've been a team effort, most specifically, the biggest amount of blood, sweat, and tears has been to Tawn, so don't anybody say anything mean to her. So if you're gonna have anything disparaging, spread it around to all of us, because it's a team effort, and it's not a laughing matter, you have to do it, and every year it just seems like we just did it. I don't know what that's a sign of, but, here we are, and so Todd, do you wanna,
On to the budget.
little summary?
Briefly to summarize it up, to give you an idea, when we sat down and we presented the budget, our budget estimate for 2016 is coming in $46,000 less than what we had budgeted in 2015, and $45,000 less than what we actually did in 2014. On that note, some of the highlights, or some of the things we wanted to mention is that we have mandated expenses. They total $4,163,363, that's a big difference. $4,163,370 before we, submitted some adjustments. The total adjustments that we did to the budget, are primarily payroll related and fringe related. and they totaled $290,815. So we've done almost $200,000 in adjustments to lower our budget. Some of the highlights that we wanted to emphasize was, the first thing was that our long-term care program is slowly, I guess, being eliminated. Is that how I should say it, Sharon? And so we're being proactive. The supervisor of that, we budgeted for 80% of her salary to go to the CHA. She is assisting in that supervision role over there, and keeping 20% within our long-term care program. We also had a retirement in our long-term care program that just happened in August, and therefore we're going to eliminate that position, that fringe in that salary. On another note, in our CHA, our Certified Home Health Agency, we are currently trying to recruit nurses. We've had a little bit of difficult time. Sharon does have somebody new starting in October, but we still have a couple positions there we have to fill. But in the meantime, in our budget, we did also reduce 2.4 nursing positions by attrition, so no one is losing a job within our certified home nursing. We also, my position it has always been under the Certified Home Health Agency, but my position really does work for the whole agency, both public health and health services. So we are moving my position in salary and fringe to the Preventer program, which is where Pat, Tammy, and Janelle sit and make sense. And then we will be able to get state aid on that, minimum 36%, hopefully more when all is said and done. Our WIC program, our Ebola program, and our BT program, bioterrorism, are all a zero effect to the county. Those grants are fully funded. In our WIC program, it does on our summary sheet show that we have a loss, but we got a small grant for $45,000 that ends September 30th, and the position that was within that grant therefore is being eliminated, and that was $24,831. So once we back that salary out with that fringe, again, the impact to the county is zero for the WIC program. Our disease program, we have clinic nurses and we have one per diem nurse. In the budget, what we suggested is the clinic nurses' salaries seem to be a little bit higher than really what they should be, so we reduced all of those. And then we also increased then the per diem line. The net effect of all those decreases and one slight increase is that we are asking to reduce salary and fringe by over $18,000 within the disease program. Our health education and bioterrorism, our health educator, senior health educator, in the past few years with BT, he's kind of taken on like 3 or 4 different hats. But in bioterrorism, we were splitting his salary 50-50 and looking at everything and really where he stands and all the work he has to do. We are now moving that from 60% into health education and 40% into the bioterrorism program. So in that case, it's just taking money out of bioterrorism, moving it back to health ed, so no effect to the bottom line there. And the last thing is our Ebola grant we got this year. We had asked back in May, there's a slight per diem position with that, with fringe totals $4,064. I guess because we haven't filled that position, it's just per diem. Probably we're going to look at probably filling it in 2016. It's not on the salary schedule. So therefore, I was told that I needed to ask for that again. And then again, that would bring that grant up to where it needs to be, where it would be no impact to the bottom line of the county. With the mandated programs are, in this case, our preschool, our early intervention, our disease programs. All 3 of those are mandated programs. And Pat is part of the Director of Public Health, and Dr. Larson, his position are also mandated. When we look at the total impact that we expect to have for the county, of that, 82% of that are just mandated related. That, there's nothing I can do there. Our preschool and our early intervention numbers haven't gone up; they've kind of gone down. So, and looking at a 5-year future going out, we did keep those numbers down. What we said also with our nursing positions is, if we find that as things go up and we eliminated a position, but if we need it back, we will come up to the committee again. And of course, it's a revenue earning position, and we need to emphasize that if we do need more nursing positions. I don't know what else, if there's anything specific. Your second page is a summary of everything. The peach colored are the changes that we're anticipating to make or we've requested. And then the next column tells what would be our bottom line if all those are accepted.
Could, the, total appropriation you're showing is 11,292?
11,292,695 is what it is before the adjustments. You would take off the 298.15 that are all in the peach color.
Oh, no, I understand that. I was just wondering
Yes, our total agency is 11.
Is that a total appropriation? That's down from 15, total appropriation, isn't it?
Our preschool was one of the big ones. Of course, like I said, our preschool program we reduced, our early intervention we reduced. Those usually, and they're mandated, those usually are big numbers. So we kind of looked at the history, where it's been. I mean, if we get a big flush where we get a bunch of children and we have to, then we would have to come back, but we're trying to go with where we've been the last few years.
Isn't that almost $500,000?
That
Total appropriation, I mean, you're showing on your budget sheet, total, budgeted, 2015, 11.938. We're showing, is there something that keeps this from totally correlating?
the 2015 budget, we budgeted 11,938. So it's only 11,292. It's only like a half. Were you saying more than that? Were you saying? Were you saying 15 million?
No, $500,000. It's 11,292,000
11.
as opposed to 11,938.
Correct. Again, most of that, we have reduced most, but most of that is in reduction of, I believe, in the preschool and the EI. Preschool alone is usually around $4 million.
One of the things with the preschool program, we used to have, BOCES used to provide a preschool program that was very, very pricey. They went out of business. So what we needed to do, because our plan was not to send kids down to Albany to those kind of programs, we looked at different ways that we'd be able to deliver the same caliber of services, like maybe do speech 3 times a week in the home or whatever, and that has translated to being much more cost effective. And luckily, I guess lucky or unlucky for us, we don't have a lot of agencies that provide classroom services, and those are the ones that are like the $30,000 a year situation, and with that comes the transportation. So that did significantly reduce the cost. And it's also been good for us because we provide a lot of those therapies from the CHA. And so we don't have to buy it from other agencies. So that's only good. We are always hesitant with that because we could always have, God forbid, a family has a child that really has a lot of problems. You never know. But I guess we've come around the circle that just because it was that way 10 years ago, we don't do it that way now. We will just have to budget based on what we've been seeing.
And no, it's not every day that a department comes in and asks for $500,000 less appropriation, shows up a $500,000 less in appropriation, but then I guess my question is, on the other end, in terms of the net cost to the county, those numbers, I'm not pulling them quickly here, but you're estimating that the $2.2 million would be the county, I guess way to say it is the share of that? What you anticipate to be?
2162801, that is what I'm saying would be the bottom. Also, back to your question before, I just wanted to bring to your attention that 2014 total expenses that we actually did last year was $10,984. And even though we budgeted in 2015, as I usually state, the expenses, again, it's a budget, but if we don't necessarily meet those expenses, then usually the revenue correlates with that. And my concern is always that our bottom line impact is the same or less to the county. We always say, well, our revenues look like they're behind, but our expenses usually end up, they correlate with that.
And the 2209,444 would relate to the previous year, this year's budget.
2209,444 was the budget, and the 2208153 is the last column, is what actually was our impact to the county in 2014, all the way to the last column.
Right, I see that. All right, so you're actually showing, am I reading this correctly, 2209,444 was for the adopted budget for 15 and profit loss after administration, and yada yada, in 16 you're anticipating 2162, is that?
Correct. And the difference between that is 46,643 is where we're coming under. And compared to what we actually did in 14 and what we're budgeting, we're coming in under 45,352. So about 46,000 is where we, right now, with the changes, where we anticipate to come.
It's such a pleasure, Mr. Chairman, if I might add, to have, financial information that's so crystal clear. I mean, some of us are looking at some of these sheets for the first time, and it's just very clear. It paints a very clear picture. Thank you.
You're welcome.
Supervisor McDevitt?
I just had a quick question on the 2015 vehicle list, referring
That's the last page.
Thank you,
Referring-
Tom. Thanks, Tom.
referring specifically to the first loaner car at the top there, it's a 2007 tan Ford Focus, 93,386 miles on it, and your repair bill was $57.50. I guess my question is, how come your repair bill is so low?
And that's, it's a loaner car right now, it is one of the older ones, so we don't put a lot of miles on it. So probably because it isn't driven every single day, it's used when our per diems come in. I mean, and this is as of June, I gotta tell you, we might get another one. But we give you this list, so they now, tell us how many cars. We used to in the past ask in budget, we need 2 or 4 cars. We'd like you to see where the mileage is. As we said to Mr. Dusick during budget, it's been good working with DPW and getting our cars repaired. And now that we have, obviously, you see a newer fleet, you'll see a lot less in repairs, which has helped us a lot.
Thank you.
A lot of times you don't see those numbers big because the nurses aren't driving them and saying, you know, I'm hearing this noise in the back of that vehicle, so, yeah.
Are we ready to make a resolution for this budget? Okay, motion made by Supervisor Conover, second by Supervisor Frazier. Any more discussion? All in favor? Opposed?
I didn't, fill out a resolution form for the budget. How do I go about doing that?
You don't,
I was just told you don't need to.
Well, I don't have to do no more papers for that budget part?
Guess not.
All that savings and less paper.
Supervisor Brock, I apologize, you did have your hand up. Did you still have a question or a comment?
Just on the competition, I understood the certificate of need is about keeping, competitive costs down. With all this competition, do you see that going up, the prices of things? Or
No, our prices don't go up because they're very.
Not yours, I'm saying others.
Others, I don't know.
Well, you know, you're in competition with other
Right.
competition. Do you see prices, I mean, what they found was when there's competition in the medical field, a lot of times the prices go up rather than down.
No, because it's controlled by CMS. Medicare and Medicaid, who are our biggest payer sources, control the fee that we get paid. It's
You're
based on,
paid, right?
yes,
But
regardless,
others-
regardless what agency you're in.
Oh,
When
okay.
you're in the certified business, that's pretty, controlled, of what they reimburse for based on assessment and then a whole process.
And the reimbursement process is somewhat connected to, the pay for performance. So when you submit all of your data, ours is really good. So that'll put us in a really good position for getting the
For marketing.
highest rates that are possible. And if you're just doing kind of mediocre, you'll get paid less.
Now, are your fixed costs, do you have a lot of fixed costs in relationship to those so that you end up not being able to refund it because of the competition?
Well, yeah, no, because it's based on, again, it's tied to quality and performance.
Right.
And those are our marketing things that we, will go to competitors for in the managed market.
Right.
And you look at delivery of care, whether you use telemedicine, your delivery of care for wound care, can we do it with maybe a little higher product, but yet we're doing less visits? Because they pay most, reimbursement now is paid on a 60-day episode. They give you a chunk of money, here, go figure out how you're gonna use it to get the best outcome for the
Yeah,
patient.
okay, right.
So that's basically the whole scenario of
So you're in a
the
better
certified.
position competitively?
We are very much so, because we have excellent scores on our STAR reports, which are above the average, and on our home health compare reports, which are the report cards for the certified agencies, we're up over 90 percentile. And that is, I am extremely proud of our staff. We're up to like 90, what was it, Tammy, 93 point something percentile. That's excellent.
Right.
No, so those are the things we market with.
When I met with you last year, I was not sort of echoing what Ron was saying, I was very impressed with how you, including Tom's budget.
Our budget. That's okay.
All of it.
Our
I was
budget.
very- not just,
In it, there was a CFO forum that you allowed me to attend last week. And in that forum, they talked a lot about value-based payments. So in a value-based payment, obviously, we're talking about the cost to provide service and the value. So what Sharon was talking about, your STAR report, your home health compare, there's your value. On the cost side, I can say that now the state is moving to a capitated rate. So for a patient, you can, your charge could be whatever, but it can't go above this rate. We are well under that rate, because what they do is they look at the whole state. So you have New York City, you have us, you have the services that are provided, and then you have your value. So our rate is very reasonable. The patients get the services that they need, yet, and good outcomes, and yet we can keep that rate at a reasonable amount. So we've really put a lot of effort into positioning ourselves for the future, for being able to deal with the fact that the CON has been opened and that we have competition, and trying to, when you look at each budget year, being very conservative, having the pieces in place so that you can, move around a little bit as you need to, as you look at your referral sources, because 2 years ago, frankly, we weren't sure what we would see with the CON opening. You have 2 more people coming in doing business. Now you have 4 more people. What are we going to see? Our nurses are phenomenal. We provide excellent care, and at a good price, a competitive price.
Presently, we have positioned Warren County's CHA to be competitive in 4 to 5 years with value-based payment. That's why we spend an enormous amount of time on our OASIS data. These are more particular things that give out those STAR reports in that home health compare. So when we sat here and we looked at this budget, I'm already thinking that reimbursement is going to be for the CHA in 4 to 5 years, because CMS is now doing a pilot program federally. New York State isn't in it because we are so messed up in New York State, they don't want us in it. But they're setting the base, and that's what the reimbursement will be. So, as Tammy said, you keep watching and listening to value-based payment, because that's what it's all about. And if we don't position ourselves now, and I've given you my word, we are positioned. And we will be able to, when whoever's here in 4 to 5 years, to be able to move it forward. With that said, I think.
I have to say, I was very impressed.
Just one last comment. That agenda that the chairman was talking about, I have an extra copy of it, of the so-called competition. I don't know if it's as specific as maybe you want it to be, but that was what occurred yesterday. Yeah.
Thank you.
You're welcome.
Okay, anything for the ladies at Public Health? Supervisor Thomas?
I would just like to echo everybody else. I sat on this committee for 8-9 years, and I've been budget officer the 3rd year. And every time we do the budget, it's, I have really no worries, because I know that it's their budget. And I just have to echo the services and the budgeting is
Thank you.
Thank you.
Yeah, I'm tired of commenting on how great they are. Okay, thank you, ladies. Sit tight, we have Rob and Harry from Mental Health next.
Thank you very much.
Thank you.
Have a nice weekend, ladies.
Sounds like a show, ladies of public health.
I found this message that Michael will be calling in the next couple of days.
Hey, Ralph, how are you?
And he said,
Thank you. Sorry.
How are you, Rob?
There you go.
Good morning. How are you?
Good, how are you?
Whenever you're ready, Rob, take it away.
Okay, so what we have on our agenda, this morning, we put, a little bit of 2015 business first, and then we have the 2016 proposed, budget. So the first item that I have, listed here is the 2015 budget amendment. It's a resolution request to add, $19,920. This is 100% state aid from the Office of Mental Health. It will, it's effective, mid-year for us this year, so next year it'll annualize to $39,840. This is funding, related to some new mandated duties that the Office of Mental Health is requiring, related to, the Offices of Community Services and, children with, serious emotional disturbance, and particularly who are receiving, high-end services. And the, federal government, is requiring New York State to do certain things related to this, Medicaid waiver. And, the state has been asking the counties to perform the additional duties. It's more screening, it's more assessments, it's more working with families and determining level of care and ensuring that there's, conflict-free, arrangements among, the providers of the care coordination and the various services that the people receive. So, because they're mandating the duties, they made some funding available, which we applied for, and we were granted funding for a full position. So this funding would be for the position. There's a related, resolution request, follow, for the creation of a new position. The funding that we're receiving is split between the two counties, so the funding that I'm proposing here is half the funding. The other half would be in Washington County.
Need a motion for this resolution, made by Supervisor Conover, second by Supervisor McDevitt. Any discussion? All in favor?
Aye.
Opposed? Carried, okay.
And the second request to, create the new position. We would look for a master's level for this, that's what we proposed. We proposed a salary at, $53,500.
I'll move it to the floor.
I'm sorry, motion made by Supervisor Conover, second by Supervisor Frazier. Discussion?
This is, 100%, reimbursable?
This is 100% reimbursable. The state is reimbursing initially 100%, and then we do have a mechanism that's called federal salary sharing. So, to the extent that we're able to pull in some federal salary sharing for the position, the state has indicated that to the degree that we are able to do that, they may back off state funding, so capturing the entire amount through either state or federal funding.
Maybe just briefly, you could, maybe, tell us the need and the corresponding duties.
Yeah, and attached here is a new, position duty statement. It does list some of the duties. What we would propose to do is we currently operate a children and youth, single point of access. This is like a referral, single point for referrals for high-need services. And we currently have these duties combined into our deputy director position, so that our deputy director is doing a single point of access for kids and also a single point of access for adults. So what we're proposing is to break off the children's piece into a separate position, in addition to the new duties, which include the completion of a assessment tool for all, referrals for waiver services, which also will include, designating this person as a county lead contact for children and youth, mental health, service issues. They'll manage all the referrals, really serve as like our person for kids' issues and liaison with the state agencies, with the local providers, as services sort of transition, Medicaid, reforms continue to happen. We're having more and more interaction with, managed care companies, and so this person would probably also be
So
involved.
this would be the person that everyone would know would be the primary. Now, how are those duties being handled to this point?
Currently, that is all together in our, deputy director clinical.
Oh, wow.
But there's significant new duties that
Sure.
are being required here, and that's why the state did come up with funding for an additional position.
Yeah, no, I can see this as a very busy position.
Is this both counties also, Washington and Warren? Yeah.
It'd be a shared
Wow.
position similar to.
Very busy position, I would think, yeah.
Makes you wonder how we made it this far without it, really. when you
No,
think
no,
about
it's
it.
a very good observation. You just have to pick up the newspaper and
These
turn the
documents-
TV on, yeah, so.
These documents are labeled draft because we're really still working with Trish Menninger on finalizing the job description and the new position duty statement.
How long would you think it would take you to get this individual on board from this point?
I would think within the next 4 to 6 weeks.
Great,
Very good.
thank you.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Thank you. Just a couple of other quick updates. I did wanna, keep the committee updated that we did backfill or, through promotion, our deputy director clinical position. So, Lisa Kutu has been, appointed into that position. She was previously a program analyst in her office. We're now going through the process of backfilling the program analyst, and, that should be posted within the next week. And then we'll move forward with the children and youth SPOA coordinator.
Okay.
And, one other update on the, People Inc., we had talked about that, at one of our last, committee meetings. I did just wanna keep the committee, apprised that, they did have an appeal with the, zoning board of appeals, Glens Falls, and they were successful, so they have resumed operations there in Glens Falls. And, we're trying to monitor them closely, see if there are any issues or any problems that come up. Certainly, if anybody hears of anything, let me know. And, we hope it turns out to be a very positive, service to the community.
Thanks.
Yeah.
I'm sorry, Supervisor.
Now, you're talking about the Rose House?
Yes, Rose House.
Yeah, they came before the, zoning board.
Yep.
And I spoke, one of the there were two problems we had with it. One was that a neighbor had talked to one of the residents who said they were doing drug counseling, which is not what they're supposed to be doing. And since it's by peer, management or whatever, they can do whatever they want with, unless there's somebody monitoring it. And the other thing was which is a general thing, is if you could ask them not, the problem with Glens Falls is we have so many nonprofits. I figured it all out recently. The amount of nonprofits we have in the city comes to at least $150 million. It represents over $5 million in lost revenue. And the more that's added on is the more it puts the burden more on taxpayers. And they were only like maybe a couple blocks away from being in Queensbury, where they could have done the same thing and not affected Glens Falls in the same way. So if you could sort of tell them the problem and sort of persuade them to go to, and not that I'm.
Or Hague, or.
Yeah, no,
Yeah.
well, compared to other towns, we are by far, the amount of nonprofits that we have is far greater as a percentage of our tax base than just about anybody else. The only one that's worse is Stony Creek, I mean, really.
I think that there were particular benefits for them in looking at trying to locate near the hospital. It's actually within walking distance of the hospital, so if they do have somebody who needs to be seen in the emergency room, they actually have trained staff that could walk with them and take them over there. That was one of the benefits of that area. But I hear what you're saying. I know it's a concern.
Well, they were still within, if they went to Western Avenue, that's still within it's almost the same distance, just a little bit farther away.
Okay. Last item?
Last item is our 2016 proposed budget. So what you have in your packet there is a separate stapled handout. Includes the normal budget pages that you're used to seeing, but on the top we put a copy of a table that we use with our community services This lists, this is a comparison from 15 to 16 of, first of all, our office expenses. The administrative expenses is number one, and then a list of our contract agencies. Actually, I neglected to introduce Harry Carlson as our Deputy Director Fiscal, and this is really Harry's work, so we can go through it together. The chart shows you a comparison 15 to 16, but as you look at the columns further out to the right, you can see we do also detail where the county funding is, in which contracts, and certainly in our office expenses, and then where the county changes. So the places where there are county funding in the contracts, those are held flat this year. And so the only county change that you see reflected here is in our office expenses.
A lot of money. Do you reflect the new position, SPOA coordinator in this budget?
Hey, yeah, we're looking at.
On the staffing page, I was just looking at the staffing page.
It's reflected only on the front page.
Only on the
table.
front page, okay. That's why I was asking, okay.
Because it wasn't approved yet, we did
Sure.
not
I understand.
incorporate it into the actual county budget.
So if I'm reading this correctly, you're anticipating expenses of the 3862461 as opposed to this year 3904, and you're showing a net operating support of going from 161,435 to 154,011, is that correct? Am I reading that correctly? It'd be on page 5 of 12. Your column to the far right would be 16, correct? It's not titled at the top of the page, so you have to go to the first page to kind of, yeah, your column to the far right is, you're showing as your departmental request, and your 2 columns over from that, third counting the last column, is your 2015 budget. So, and you're showing our revenues going from 3,743,000 to 3,708,450. So, am I reading this correctly? You're actually showing a reduction in the amount of net expense to the county, I guess is the way I would phrase it.
Trying to follow what you're saying there.
On page 5 of 12, Mr. Chairman, on 5 of 12, we're showing 2015, correct, budget?
Right.
2016. Way to think about it, right there.
Gotcha.
Right here. Way to think about it is like this.
So the question is,
It's a little
is
difficult
showing
because
a
you have to go,
net decrease.
you have to go, page 1 to see the titles. So you're showing a slight reduction in revenue, slight reduction in overall expense. But then again, this does, as you say, this didn't reflect the addition of the new position plus the revenue of the new position, correct? All right, I see that now. Okay, thank you. That would be reflected on your this summary page.
The other thing I would mention and point out is that what's not reflected on the table that you see on the front is reflected at the bottom of 512 there. You see a couple of lines related to psychiatric expenses, criminal and non-criminal. And those are 100% county dollars. And, those are expenses that we really have no control over, court orders, certain services, we have to pay for them, so.
Well, if the position that we just spoke of, this BOA coordinator, is, zeroes out, then the differential number shouldn't change here. Your expenses should go up by that amount, your revenue should go up by that amount, and so I guess your net anticipated would be, for 16 would be 154,011. Is that correct?
Actually, just a question on the reduced revenue, that's in person. Because this year, 2015, there's an additional roughly around $25,000. It doesn't continue in 2016. Okay, that's where the decrease in the revenue, I think that's probably where it is. There's some startup under the Parsons contract.
Well, the expense and revenue number would increase by the 53 reflected on the summary page, which isn't reflected here. So actually, the expense number and the revenue number, in the end, is probably going to exceed 2,000, and both the expense and the revenue will exceed 2,000 in this year's budget by that amount. That's correct. That's what I was going to there. All right, thank you.
Supervisor Seaver, did you have your hand up?
I did. I just had a question regarding one of your line items. When you look under your contractual expenses, line item 444 under your travel, education, and conference, you have, 6,000 as a budget request, but to date you've spent about 2,400. Last year it was around 3,900.
Yeah.
And when I look at your expenditures from 2012, 2013, both of that, those numbers in that 444 line item is about 3,200 and 3,700. I'm just wondering why, the expense is budgeted at 6,000 when historically over the last 4 years it's been right around 3,000.
Well, we have tried to do our best to eliminate travel, cut back as much as we can. There are more opportunities, it seems these days, for webinars and teleconferencing, so there's less travel really than we used to do. We are anticipating bringing on some new staff, so we didn't bring it down, I guess, this year, but we still try to watch the expense and see over the past few years, we've tried to keep it, minimized.
I just was thinking if it was a differential of $2,000, maybe it's time to bring down the request of the 6,000 a little bit closer to what your actual expenses are. I mean, recognizing you're bringing on a new staff person, there should be some increased need.
Well, we did bring that up, Paul and I did, and we left it in there only because we didn't feel we would want to come back if by chance there were extra traveling. For the $2,000, we weren't really too concerned about it. So, otherwise we're looking at coming at the end of the year begging for money.
Right, I'm just wondering, because the last 3 or 4 years, it's never exceeded around 3,000.
Right.
So I guess next year, after this person is trained, we'll see that number go down a little bit.
Well, we can bring it down this year if
I just wondered, I mean, if the budget team, it's the first time I've looked at it, I just wondered.
Yeah, it's a reasonable.
Thank you. We'll bring it up again. Okay, did we get a motion for this? Okay, we need a motion to approve the budget, please. Made by Supervisor Conover, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried. Anything else, Rob? Motion to adjourn. Made by Supervisor McDevitt, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Well, I gotta tell you what, you guys are.
Thank you.